Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. Did you know a small percentage of children are born with hearing difficulties? A small percentage, but others can develop issues over time. So today we're talking with audiologist Pam Adkins about what we can look for in our children and how we can get things checked out. We're excited to learn more about this. I know kids are routinely checked at different ages. What can parents anticipate with that?
With that, in West Virginia, since about '97, they passed a law that all babies are screened at birth, which is wonderful because so many didn't get detected until they were starting school and already a few years behind. So usually at birth they're screened, although not all parents realize that because they give them all the paperwork you get and they scan it.
It's a very busy time when they first arrive.
It's a very busy time, but they get follow-up if they need it. If they fail, they then go on and are tested at a facility like Valley Health ENT. As they start school, first grade, they also are screened and get referred. And a lot of times at that time they catch problems with kids that have a lot of ear infections, fluid. And that's really important because if they don't catch that, they're sitting in a little classroom with their ears all plugged. And if they don't necessarily have infection, it's just fluid, they can really struggle to keep up in the class because they have a temporary hearing loss.
Right. Let's talk a little bit about what the hearing screening entails. What does the exam look like? What could mom and dad expect?
Depending on the age of the child, if you have a child that's about 3 and under, we usually put them in a sound booth with speakers, and we call it sound field testing. We have little animals that are hidden in boxes, so if you call their name and they turn and look, you reinforce them and get them to test them that way. If they're at least 3, it depends on the child sometimes too. Some younger can do the hearing test with the headphones and raise their hand. But we do have ways to test them if they are not as able to follow along. With the sound field, it works well.
But something age appropriate, not scary for the child.
No, it's a little duck and raccoon,
something
and
friendly
like that.
and fun.
And they like them,
Yeah, I'm sure.
Usually.
You'd mentioned, sometimes kids have fluid behind their ears and don't even know it. Are there things that parents can watch for, some kind of indication that maybe there's an issue with our child's hearing and we should have it looked into?
A lot of times parents just come in and say they just don't hear me, they don't follow directions. I can call his name across the room and he's not paying attention. Other people notice it. If they're in school, a lot of times teachers say he's having some trouble, and that's how it's usually picked up. Parents are usually the best ones to find out first, and they stay on top of it usually. But if kids are just acting like they're ignoring you or not paying attention, or they do complain of maybe stuffiness, or if they've got allergy symptoms, that can mean they could have some fluid.
You mentioned temporary hearing loss with sometimes when their tubes are full of fluid. How quickly does that dissipate? And what are some things that we should watch for that may cause some permanent damage, things that kids should avoid?
Right. With the tubes inserted, if they have a lot of fluid in there, as soon as they're inserted, their hearing should come right back because it is just a blockage. Sound waves can't get through that fluid as well, and it does dampen it down a good bit. But other kids, teenagers and preteens, and everyone that's wearing Beats headphones or iPod, earbuds, having them at an extreme volume for a long period of time is not a great idea, even really a short period of time. And as you and I were talking about, if you can hear your child's game or music through their headphones, you probably need to have them turn it down.
Turn it down.
Yeah.
Because that kind of hearing loss can be permanent.
It can be, and it doesn't happen all at one time. That's something that wearing the headphones or for years over time, that's when you notice it later. Not necessarily now, but it can come, and it's usually irreversible.
And how can parents make an appointment? They think, I really do need to have this checked out.
Yeah, they can call or they can look online, look up Valley Health ENT or audiology. Depending on the insurance, you may need a referral, but you can call and just make an appointment. They can have just the hearing test, or they can see a physician and have the hearing test if there's a concern for fluid or earwax or drainage or anything like that. It's good for them to see the doctor.
So don't wait. Early
Don't
intervention
wait.
is
Yes,
always important.
absolutely.
All right.
Sooner the better.
Sooner the better. Pam,
Yep.
thank you so much. A
Thank
lot of
you.
great information for parents.
Thank you.
Thanks for being here for Valley Health Minutes. We'll see you next Monday.